What are the risks of infectious disease for emergency medical services? Imagine rushing to save someone's life, only to face an invisible threat that could turn your mission into a health crisis. Emergency medical services personnel are on the front lines of emergencies, but they also face real risks from infectious diseases. These dangers come from the very nature of their work, often in unpredictable environments. First, EMS responders are likely to come into contact with patients carrying high-consequence infectious diseases like COVID-19, tuberculosis, influenza, or Ebola. These illnesses spread through tiny droplets in the air, aerosols, or contact with blood and bodily fluids. Because EMS work happens in places like accident scenes, homes, or crowded public areas, controlling exposure is tough. Second, identifying infectious patients before contact can be difficult. Many infectious diseases show vague symptoms or patients might not show any signs at all. This makes it easy to unknowingly expose yourself. Plus, inconsistent training and not always following infection prevention rules can increase the chance of getting sick. For example, studies show that hand washing among EMS workers is often not done as regularly as it should be, raising the risk of spreading germs. Third, EMS responders are at risk of needle sticks or injuries from sharps when they perform invasive procedures like drawing blood or giving injections. These injuries can expose responders to viruses like HIV, hepatitis B, or hepatitis C, especially if protective gear is not used properly. Fourth, personal protective equipment is vital but sometimes not used correctly. Variations in training, equipment availability, and operational pressures can lead to gaps in safety. Some EMS systems lack strict standards for infection control, which can leave responders vulnerable. Fifth, during infectious disease outbreaks, EMS resources can become strained. Responders might need to quarantine or fall ill, leading to staffing shortages. This can slow down emergency responses and affect the entire system's ability to help during disasters. To manage these risks, EMS teams need thorough training focused on recognizing and preventing infectious diseases. Proper hand hygiene and consistent use of protective gear are essential. Clear protocols for handling suspected or confirmed cases help keep everyone safe. Specialized transport procedures for high-risk patients prevent community spread and protect responders. Regular drills and ongoing education keep teams prepared for infectious threats. In short, EMS personnel face real risks from infectious diseases because of their exposure to diverse pathogens and unpredictable environments. Addressing these risks with proper training, equipment, and protocols is key to keeping responders safe while they save lives.